Thank you for a fantastic talk. Bittersweet, I would say, coming from R&D. But how do you think we can optimize the tool? What can we do? And how can we engage the countries? If the countries don't actually come to play with us, we're not going to finish the fight. And so can you elaborate on your last thoughts?
Thank you. So we optimize because the countries do not have enough resources. I think it's the resource base that is the reason why we optimize. Which means that at the stage of thinking about new tools, before we get there, we need to start thinking about the countries. Could this be affordable to the countries? So not wait until a tool is here before we think about introducing within the country. And cost is key. I mean, I listen to a lot of the talks and people talk about cost and cost effectiveness. It comes with generating the data. It comes with engaging with people in the country level to understand what they can afford and which of the different tools they can afford. So I think that's the first step. The next step is to ensure that once we get, and this is the role of the malaria control elimination programs, right? They have a suite of interventions. They know how much each of those interventions would cost. And I think, in effect, they need to, at any point in time, review that basket and see which of these baskets produce for them the highest benefits compared with the resources that they have. So there are a couple of things that could be done within that. Yeah.
Thank you. Umberto.
Thank you. Yeah, thank you very much. I just want to ask a question because it may seem a bit provocative, but we are all talking about malaria elimination, malaria eradication. At the same time, we are saying, well, we should use only tools the country can afford. So is that not there a contradiction? I mean, the example of Zambia showed that they put everything they have into the system to get the maximum reduction possible. Now we are talking about, well, there's not enough money, not enough resources. Is not there a contradiction about that? Thank you.
Anyone from the panel that wants to take this one? Melissa?
Thanks, Umberto. That's a great question, but I think that's why we're here today, that these transformative tools change that cost-benefit ratio. That's the point. And so thinking early on, not just cost of goods, but the opportunity savings as well that happens. And the idea here is that these you're replacing these tools in some sense, and also reducing costs would be the hope. That's what we're also aiming for. But with transformative tools, you may actually bend the curve and you then have less rollout of the other tools. That's the point. We want to stop having to keep running in place and deploying the current tools with newer tools. We want to bend it, less treatment cost as well, ongoing. So that's where this balance comes in. We can't keep running in place with the same costs.
Thank you.
Hi, and thank you. I'm Rowley Gosling. I'm part of London School of Hygiene, Tropical Medicine and UCSF Malaria Elimination Initiative and part of the Secretariat for the Lancet Commission of Eradication. And it's really excellent to hear this bit, which we called in the commission the hardware of eradication. And Justice has represented the financing, thank you. But the bit that's kind of been missed out somewhat here, but Busiko did talk to that, is the software bit that I think is that also needs investment. And this is a fantastic to see what's coming and the opportunities that lie before us, but we still have this kind of health systems problem at the heart of it, which is how do you get the tool to the population that need it? And also this idea of prioritization, how do we prioritize? Now we have some terrible news about the funding going down, but it does give us a huge opportunity to change how we do things. Under the kind of donor-driven priorities that we had before, we had siloization of programs, we had vector control separate from case management, and now we have a chance to kind of have much more an integrated approach, a whole of program response. I think another thing that we sit here often In the global north, you know, we have our great inventions and we say, okay, we just need to model it at 30% coverage, and what a huge impact we have. But the reality is, of course, that doesn't happen. So I just want to kind of do a shout out that we are investing well in R&D, but there also needs to be a huge investment in the software and the capacity building, the problem solving, if you like. One thing that I have noticed when for a long time I worked in low endemic areas, and the last 4 years I've been working in high endemic areas, and I see the coverage that is actually reached in the populations. And what I see is I see programs layering on one thing onto another, but there isn't the problem solving to say, why haven't I got that coverage, and how do I get that coverage? So just to say that it's not necessarily, and Rick's here, and the whole idea of kind of scaling up for impact and getting that scale. And in fact, PMI was a huge driver of just trying to improve the tools that we have. But we really still have huge gaps in real life in large parts of the high burden countries. Thank you.
And it would be nice, for instance, to see more countries actually do what Zambia has done, right? So if we have a Nigeria that does what Zambia has done, it would be fantastic. I think we are at the hours, unless there is any burning question, but I see that you are sitting well and comfortable. I would like to thank you for attending. I would like to give a big shout out to Lizzie and Bradley at the MMV Comms, because they've done a great job. And I leave the closing remarks for Jean-Luc.
Thank you, Cristina. Thank you all for joining early this morning. Thank you to our speaker and our esteemed panel. We are impatient optimists. We are all in need for some good news in global health. And hopefully we'll let you go this morning with a renewed sense of optimism around malaria elimination, around how we can hopefully get there, and a renewed sense of mission, not just about the moral imperative I think we all share to reduce malaria transmission, reduce malaria death, go to elimination, but also with the sense that if we craft the message properly, there is a very profound and strong economic justification that underpins malaria elimination. And I think it behooves all of us to make that case every day on an ongoing basis. It is a good investment, and we have to realize it. So hopefully we can transform the cloud into rain. Thank you all very much. Farewell.